Hello, how are you today? We good to go? Well, good morning, Queensland. It is wonderful to be here at the Brisbane Entertainment Centre, Boondall, for our first big walk-in weekend visor blitz. And there are lines behind me and outside, and I just heard that people have been lining up since 4 a.m. this morning, and I'm hearing the same across many of our big vaccination sites across Queensland. But before I talk about our big Vax weekend, I just want to report that we've had one new case overnight. This is a locally acquired case that is linked with the Sunnybank cluster. That brings this cluster up to 11 people. This person has been in home quarantine for their entire infectious period, which is great news. That's what our contact tracing and our quarantining is all about. So a big shout out to all of those people who have been identified as close contacts by our contact tracers and have gone into quarantine. Their decision to do the right thing and abide by those directives to stay home is the decision that is keeping everyone safe and stopping this virus spreading throughout our community. And of course, a big shout out to the individuals, the father originally, the work he did, letting our contact tracers know where he had been and who he'd met with, meant that we could get these people into quarantine quickly. That now means we have 29 active cases. We did 11,481 tests overnight and 25,168 vaccines. I think that might be beaten over the weekend with the sorts of lines that we're seeing today. That now means we have 58.75% of eligible Queenslanders who have had their first dose. And the exciting news that overnight we have tipped over the 40% mark, so we have 40.54% of eligible Queenslanders that are fully vaccinated. Remember, across the country, our target is to have 80% of the population who are eligible fully vaccinated. So we are halfway there, Queenslanders. Let's keep it going. Get online, book a vaccination, walk into a community pharmacy or go to one of our community vaccination hubs. And this weekend we have 38 community vaccination hubs open by Queensland Health. We also have the Commonwealth Respiratory Clinics. I understand that they've agreed to step up over the weekend as well. Of course, GPs are vaccinating today and so are our community pharmacies. So I think with the Commonwealth Respiratory Clinics and our hubs, we have 44 sites that are open for this Vax weekend today and tomorrow. Now, I remind everyone who's coming for a walk-in, it is a warm day out there. You know, we know as Queenslanders it can get awfully hot. So please bring a hat, some water, maybe some sunblock if you're going to be standing in those lines. If you have a booking, that booking will be honoured. Please turn up for your booking as well. Now, I'm already hearing some of our sites are hitting capacity. So the Logan Entertainment Centre currently are cutting off their walk-ins and redirecting people to other sites. So throughout the day, we will be letting people in the lines know whether we need to turn them away for today and whether they should either go to other sites. So I'm hearing Mount Warren, for example, can take extra people. I have the Kipwering site on the Redcliffe Peninsula. So look at some of those smaller hubs, not just our big ones at Logan in the Brisbane Convention Exhibition Centre here at Brisbane Entertainment Centre. Also look at those other sites where you can walk in and get vaccinated as well. Of course, we're open again tomorrow, so if you don't make it through the line today, then there is always the opportunity to turn up tomorrow. And of course you can, again, get online, register and book as well. That way you'll get in and out far quicker. But can I give a shout out to Queenslanders? We asked you to roll up, we asked you to come get vaccinated, and you have absolutely come out in numbers. We are so proud of being Queenslanders. To see the roll-up today says that people want to get vaccinated. They want to make sure they're safe, their loved ones are safe. They also want to protect our lifestyle and the great, wonderful local economy that we have right now in Queensland. While other states are fighting to open up their communities, we need to make sure that we can keep the great lifestyle that we've got. So my message is this. For 18 months now, we have done the hard yards. We've had lockdowns, we've had restrictions, we've done all of this to get to this moment, and that is to get vaccinated. We said we're going to have to keep doing this until every Queenslander who's eligible can be offered a vaccine. So it's not over yet, but the quicker we get vaccinated, the quicker we can make sure that we can stay safe and we can open up our economy. Thank you. I'll hand over to Dr. Young now.
Thank you, Minister. Yes, this is absolutely fantastic. It's proven that we do need walk-ins, that we had a booking system because we thought that was convenient for people. They could book and turn up at a specific time, but it's clear people also want the ability to walk in. So maybe not everyone will get their chance this weekend because the turnout has been unbelievable, far more than I ever hoped for. So it might mean we'll have to get some people to come next weekend, but now we've got this, we'll be having walk-ins every weekend going forward. So keep coming forward. The quicker we can get everyone vaccinated, the quicker we can beat this virus. So far we've been really effective due to so many wonderful people at keeping the virus out of Queensland, but it will be coming in. We just need to make sure that we're all protected, we've got our armour, that we've had the vaccine. So thank you very, very much. Now, today's case is another point, another example of where a family did such a wonderful job, so we didn't need to go into lockdown. I honestly thought we would need to, but we didn't because of that tremendous family. So we had that young girl who got herself tested, whose mother took her to be tested, so we found out so quickly about the outbreak. And now we've got another case, and it's someone who's a close contact, not a household contact, and a work or a colleague contact of the father of that family of 5. So he was so helpful with us, giving us the names and details of all his contacts so we could get them into quarantine. So this individual, our new case today, was in quarantine for their entire infectious period. So we know that if we hadn't have been able to do that with all of these cases, we'd have a major outbreak. So thank you yet again. And please come and get vaccinated, but also continue to come and get tested. At this stage, we still need people with the slightest of symptoms to come forward and get tested so we can find that first case in an outbreak, immediately contact trace, because we know Delta can spread so rapidly, immediately contact trace and get people into quarantine. And I thank all of those people who are there in quarantine. This is tough, particularly for those kids who'd normally be on school holidays and out and about with their friends, and now they're in quarantine, having to stay at home. So thank you to every single one of those people who've just done absolutely the right thing, knowing, though, that it is a very tough thing to do. So thank you very much to all those people. So, yes, keep coming forward, keep getting vaccinated, and we will use up every dose of vaccine that we possibly can. Thank you.
Minister, more protests are planned today. What's your message to protesters now you've concerned about that?
Look, if you're going to come out today, instead of protesting, how about lining up for vaccination instead? That's what we need. We need to ensure that our economy can open up, that we can protect our community. Those who champion freedom, then there is no better freedom than having everyone vaccinated so that our economy can be fully operational again, that we can open our borders, that we can open our international borders. So my message to protesters is today is not the day to be going out and to be arguing against the vaccination or our response to COVID. That response has kept us safe. We have over 40,000 positive cases. I think it's over 45,000 positive cases now out of New South Wales from one person 3 months ago. That has now led to infections in the ACT, in Victoria and in New Zealand, all from one case back on the 16th of June. So we know how bad this can get. And I hope that these protesters understand that what we are trying to do here is simply keep everyone safe and to ensure that we can enjoy our lifestyle again by fully opening up.
Minister, how many walk-in doses
So I understand they've factored in for around 2,000 today. I am seeing if we can source more vaccine already to see if we can get some to that site for today. They'll be open. They're still open. They're still vaccinating people as we speak, and of course all the people who have got bookings there today. But they are saying to people in the line that we are going to run out of supply at that site at the moment. And so we are asking them to go to other sites like Mount Bowen. But we are seeing if we can source more supply. We still only have a certain amount of supply across the entire state. It is not enough to offer every single Queenslander a vaccine yet. But if you can't get vaccinated today, rest assured, we will make sure that we are giving people opportunity. We want to see Queensland vaccinated as quickly as possible. Sorry.
How many totally are on offer this weekend?
Look, we didn't want to set ourselves an absolute target. The target I've set for every one of our community hubs is every dose you have on hand on that site today, I want gone. I don't want any leftovers. And if the demand is so high that we need to try to get more stock overnight, then we'll aim to do that. We still have to keep some stock on hand for all the bookings that we've got coming up, particularly until the next lot of supply arrives. And people who have bookings over the next week or two, rest assured we will have enough vaccine for you to get your booking. But we are going to try to get as much as we possibly can out the door. Look, we've been averaging around 15 to 20,000 vaccines over a weekend. We want to see that number more than double this weekend. Yep. So look, we're working through how we might further strengthen the freight protocol. Department of Transport and Main Roads were going back to the industry stakeholders yesterday afternoon to just talk about some of the ideas that we have. We want to make sure that we're balancing the safety of the community with the safety of the drivers. The drivers need to be able to stop and have rest breaks. They need to be able to get out of their cabs and move around. It is not good for them to spend every minute of the day, including every meal, sitting in that cab. We understand that fatigue is a really very serious issue when it comes to our drivers on the road and our freight drivers. So we want to make sure they're safe, they're getting proper breaks, and so we're just working through how that might work. Look, I really want to see us land any decisions around any changes to the protocol by the end of the weekend, so hopefully Monday.
Minister, what do you say to the family and friends of Austin whose story was revealed today?
Oh, look, this is, it's really sad and distressing. Suicide is a very complex and a very sad outcome for anyone, and we know that suicide leaves behind many, many victims. And our deepest condolences go to the family and friends. This was something that happened in July last year. I understand it did go to the coroner at the time. We're not aware of a finding from the coroner at this stage, so I am mindful of talking about it in too much detail. But front and centre is always making sure that not only are we keeping the community safe, but those people going into hotel quarantine and home quarantine, that we're providing them the support they need.
Did your government do enough at the time?
Look, we made sure that support was provided to the individual. As I say, I won't go into the detail of what that support was, but I've been briefed. I'm aware there was numerous contacts made with the individual in hotel quarantine at the time. But suicide is complex. We also know COVID has taken many lives globally in many, many different ways. In 3 days alone, New South Wales has had 36 deaths, and it's being reported on Twitter. On Twitter, that's how we're finding out about these deaths. So there is a lot of toll, a lot of sadness, a lot of grief that has come with this virus right across the globe. So we are deeply sad for this family, and we do pass on our condolences to them.
Do you think it was appropriate for the Premier to talk about him at an event after refusing to meet with him?
Look, that's up to the Premier. She reflected on a friend that she went to school with, that she had become aware of, had passed away and taken his life. We all have those moments where in public life we talk about our personal circumstances. We talk about the grief and the sadness that we feel from other things that occurred. I don't criticise the Premier for reflecting on her sadness at hearing about that death. But I understand that at the time her office advised that she wouldn't be able to meet because it was before a coroner. I understand there's reports in the paper today there's no coronial inquest, and it may very well be that the coroner has already made a decision to not investigate any further, but I'm not aware of those findings at this stage.
Last couple of questions.
We're hearing reports that people are being told to reapply for border passes in another 10 days, that they're not able to get a border pass at the moment, there are delays. Is that the case?
Look, people do not have to keep reapplying. They make an application, and when their application is granted, it will advise them when they will be able to travel to come back to Queensland. So that's the way the system should be operating. If it's not, I'm happy to find out any examples where people are being told they have to keep reapplying every 10 days. The border pass, once it's granted, only lasts a certain period. So if you're granted a border pass to travel within a certain period and you choose not to come back in that time, you will need to reapply. But if you haven't received a response yet, you don't have to keep reapplying every 10 days.
Emails went out yesterday saying that the 10 days is out the window and it's now in due course that people will be contacted. Is that really good enough?
Look, I want all applications dealt with as quickly as possible. There are whole different types of applications that come in. Some are extremely complex that are dealt with by clinicians and psychologists. They go to end of life. They go to very personal stories around illness or medical needs or needing to come back for funerals. And then there's others who are simply Queenslanders wanting to return, or people who are wanting to relocate to live in Queensland from those other states that are hotspots. So we seek to triage those different types of applications, and where it is a straightforward application, the only delay in being able to say you can come back to Queensland now is making sure that we have the hotel quarantine capacity to allow those people to come back. But we're letting people in every single day now. The suspension was only for a week and a half. A week and a half. The Commonwealth Government has been capping and limiting how many people, Australians, Queenslanders, can come back to this country for 18 months. We've been doing it for a week and a half. To put it into perspective, what we are doing to ensure the safety of the community by ensuring there is sufficient quarantine capacity for people to come back into Queensland is the same model that the Commonwealth has been adopting for the last 18 months.
Very last one. People waiting. So
I have not seen. The last figure I saw is we had less than 4,000 open applications for exemptions. For border passes, they don't need an exemption. If you are a Queensland resident or you're simply here to relocate, that's a border pass. I would have to check on the numbers of border passes, but certainly exemptions, we don't have those numbers.
The last
We've
four
got to go
school
after this.
holidays
Thank
have
you.
been interrupted by lockdowns. The Gold Coast tourism industry is frustrated because hotels are very empty for school holidays. What is your message to the tourism industry there?
Well, my message to all Queenslanders is it's school holidays, hit the road. Go support our local businesses. Go support the tourism sector. Go visit the amazing state we live in. Because if you lived in New South Wales, ACT or Victoria right now, you are not having holidays. You are not going anywhere. So Queenslanders, we have an amazing opportunity right now to travel, enjoy our lifestyle because we do not have an outbreak. So please support our local businesses, but also to the tourism industry. What would be devastating is if we were in 3 months lockdown. That's what New South Wales have already faced. It's already 3 months lockdown and there's no line of sight of when they're coming out of this. That will destroy businesses. So our businesses are open. People can holiday in Queensland right now. We encourage people from other states that aren't in lockdown, Tasmania, South Australia, Western Australia, Northern Territory, come to Queensland. It's the best place to have a holiday.
Just on St Thomas More College, we've had several more parents overnight contact us. They say they're getting harassed and threatened by Queensland Health for an app they suggest isn't working properly. Surely something is going very, very wrong.
Look, I've asked our team to have a look at the reports that I saw yesterday afternoon around the app. If people are getting the links, the only reason they'd be getting a phone call is if they're not responding. So the fact is, if you weren't in this trial, we would normally be phoning people. That's the normal compliance system we've had operating for 12 or 18 months now. The new system is to avoid having to make those calls and actually just sending a link. If you respond to that link in time, we know you are where you are supposed to be, and we're also able to check on your welfare. So I've heard there's reports overnight that some people are not getting that text message. So I've asked our team to look at this overnight, to report to me today, because I want to make sure that the system's working. That's why it's a trial. We want to iron out any bugs. We want to make sure we get this right. But I'll certainly be making sure that our team, when they're ringing these people and asking where they've been, we're only referring it to the police. In those circumstances, we know for a fact that people have been sent a text message, they haven't responded, and they potentially are not where they're supposed to be. But we do need this level of compliance. I mean, one text minimum a day, 2 or 3, while you're sitting at home, that takes a couple of minutes to respond, is not unreasonable to ask when it comes to the safety of the community. But we are grateful for people to be complying with those directions. So we will make sure we're looking at the system. If there's any issues, we need to ensure that the system's working properly.
Thank you.
Thanks, everyone. Make sure you all get vaccinated. Line up if you haven't. Jeanette.